Hello everybody, my name is Friendly Hogan, and today I'm going to be doing something that I have never done before, and that I would have never done before. Unless, actually I'm going to have it done in probably the next few years, because I'm 14. This is a wisdom teeth removal game, or surgery squad thing. I actually did this earlier, in period 5 at my school, and I did a carpal tunnel release, and that was extremely disturbing. But, yes, squeamish adults, that applies to me. So that's exactly why I'm playing this, just to get my reaction. And yes, I turned my webcam on, just in case I make any faces, you guys could see them. So if you guys don't even know what I look like, just watch my Knott's Berry Farm vlog, and you finally get to see it. So, this counts as a face reveal. Let's do this! Let's do this shit! Yeah!
Welcome to Surgery Squad's virtual erupted wisdom tooth extraction. I'm Dr. Jeff, and I'll be walking you through this procedure today.
Oh god.
A wisdom tooth extraction is a surgical procedure in which an oral surgeon or dentist removes one or more of your third molars, commonly known as wisdom teeth.
Oh my god, we know.
Most of us have to have our wisdom teeth removed due to chronic pain or discomfort, periodontal disease, or an increased risk of damage to the adjacent teeth. Some dentists and oral surgeons may also suggest that you have your wisdom teeth removed as a preventative measure, even if they're not currently causing you any problems. Our patient today is having their lower right wisdom tooth removed, or, as a dental professional may refer to it as, tooth number 32. Before we begin, let's get some x-rays taken of our patient's teeth. X-rays, or radiographs, are essential, low-cost diagnostic tools used to examine a tooth's roots, check the health of the bone surrounding the tooth, observe the status of developing teeth, and locate abnormalities. Let's get started. First, insert a positioner into the patient's mouth.
I've been through this awful lot. So
Next, position the X-ray cylinder where indicated.
How this works.
With the X-ray cylinder in place, we need to get behind our radiation barrier to reduce the amount of radiation we're being exposed to, and take the picture. Don't worry, a lead apron will protect our patient from any unnecessary radiation exposure. I couldn't have done it better myself. I'll have my assistant finish up the rest of the x-rays, and then we'll view the resulting images. Well, everything appears to be normal with the wisdom tooth's roots. And now that all of the x-rays have been completed, we can extract our patient's wisdom tooth. The two most common wisdom teeth extractions are for an impacted wisdom tooth or an erupted wisdom tooth. Patients that have two or more wisdom teeth extracted or have impacted wisdom teeth may choose to receive a general anesthetic. When a patient has an impacted tooth removed, the procedure is referred to as a surgical extraction. Our patient today is only having one erupted wisdom tooth removed and has elected to go with a local anesthetic. To begin, you'll need to apply a topical numbing gel to the anesthetic injection site. This will help decrease any pain.
Sorry for cutting you off, Dr. Jeff.
Next, we can inject the local anesthetic. The patient may feel a slight pinch as the needle is inserted. After that, the area will become numb for a few hours.
So here we go. 3, 2, 1. Damn.
And now we'll give our patient a few minutes to become completely numb.
Okay.
Great. The patient's mouth is numb, and now we can move on to removing the wisdom tooth. First, you'll need to loosen the periodontal ligament and elevate the tooth using a dental elevator.
Just move. Oh!
Using the dental forceps, grip and rotate the tooth in a clockwise rocking motion until it's loosened and removed.
I mean, I don't mind teeth things, but... Ah!
Now clean the area using a surgical suction. This will allow us to check the area.
Okay. Okay, then. Okay, then. Okay then.
Everything looks great, but we're not done yet. Our patient needs to slowly bite down on some gauze for a few minutes to allow the socket to properly form a clot. Since the patient is clotting properly, we can go ahead and place some fresh gauze in their mouth. When getting wisdom teeth removed, it's important to remember that everyone recovers at different speeds. The rate of your recovery depends on a number of factors, including the complexity of the extraction, your age, and your individual recovery capacity. Often, patients will opt to have their surgery on a Thursday or Friday, so they're able to return to work on the following Monday. After the surgery, the oral surgeon or dentist will provide some information tips that may help speed up your recovery. These tips may include using an ice pack on the outside of the cheek for the first 24 hours to reduce swelling, refraining from physical activity for the first few days, avoiding sodas and the use of a straw, and gently rinsing your mouth out with warm salt water to help relieve pain after the first 24 hours.
It feels weird that way. What the
It's
fuck?
also suggested that patients do not smoke for at least 24 hours after their surgery.
Nobody should
Smoking
smoke.
may not only delay healing, but it will also reduce the blood supply and could introduce germs and contaminants to the surgery area. And that's a wisdom tooth extraction. You did great. If you're up to it, why not try another procedure on surgerysquad.com?
Ooh, okay. Actually, we're going to do two. I want to do this one. Let's let me make sure this is positioned right. Yeah, there it is. Okay. Yeah, we're fine. Actually, we need to scroll it up a little bit. I'm just going on XSplit just to see if I got this right. And the computer's being slow. Shit. Hold on, let me scroll up a little bit. That'll do. Alright. Bonus one. Bonus one.
Hello, and welcome to Surgery Squad's virtual adenoidectomy. I'm Dr. Susie, and I'll be guiding you through this procedure today.
Different doctor.
Our adenoids are located at the back of the throat, just below where the nose connects, also known as the pharyngeal tonsil. They are part of our immune system because they protect us from the bacteria or viruses that might enter the body when we breathe or swallow. They are more important for children than adults, and they shrink as we get older. In some adults, they become inflamed, which can lead to infections, sleep apnea, better known as snoring, and ear infections, since enlarged adenoids might block the eustachian tubes, which drain fluid from the ears into the throat. Normally, these symptoms can be treated with antibiotics, but when these infections occur more frequently, we perform an adenoidectomy to remove them. Having an adenoidectomy, if it is required, can reduce the number of ear infections, reduce recurring chances of sinusitis, and can alleviate sleep apnea. However, there's a risk of developing an infection at the removal site. Plus, the procedure might not alleviate all the problems associated with adenoids. For instance, if ear infections continue, the problem might be elsewhere. Our patient today experiences sleep apnea and ear infections.
Wow.
Let's scrub in and get to work. We'll need to use a general anesthetic for our patient. Why don't you help out? Can you find a suitable vein in the patient's hand? Looks good to me. Sterilize the injection area using
not the
a
vessel. I hate when things go into the blood vessel. No! Oh god.
Insert the needle and advance the angiocatheter into the vein.
Itchy. Oh god. Ah!
The small burst of blood in the angiocatheter hub is what medical professionals refer to as a flashback. This lets us know that the angiocatheter is correctly positioned in the patient's vein. While placing a small amount of pressure over the vein to collapse it, remove the needle. This will reduce the amount of blood that may discharge out of the angiocatheter when the needle is removed.
Oh, thank you. Thank God.
Now that the needle has been removed, I'll dispose of it in a sharps container. We need to secure the IV with tape and test the line. Great! Now we'll wait a few minutes for the anesthetic to take effect.
still in there. That sounds so uncomfortable.
One more thing. Since
is
we'll
he
be
dead?
working in the patient's
No, he's
nose and mouth area, we'll need to make sure he can breathe. Let's insert a breathing tube into one nostril.
Only one? Okay, that works. I like how it's just like...
Great job! Our patient is under and breathing.
It's like how
Now
some guy
we're
would,
ready
like,
to
stab
remove the
her, like,
adenoids.
I
We'll
watched
begin
the
by
revival
putting an
and it was
endoscope through our patient's nose so that we can view our work on a monitor. When we reach the back of the nose at the entrance to the throat, we'll be able to see the adenoids. Okay, good. Now we can see the adenoids. We need to open the mouth and get the tongue out of the way so we can begin our procedure. To do that, we'll use a special retractor
Oh,
that
that's what
opens
the
the
other
mouth,
nostril
depresses the
opens.
tongue,
That's why
and
it's
locks
open.
into position.
Oh my God,
Great
my cat
work!
won't shut up.
We're going to remove the adenoids using a device that uses suction cautery. The device uses electrical pulses to liquefy the adenoid, then suctions the...
Oh. The cat's meowing like a little bitch, even though he's a guy, so it's a bastard in this case. I was referred to guys as bastards. Dude, that looks like fucking rocks. Those look like rocks. It's gonna be the last of it. Sorry for the lag. Oh, that looks so rude. That looks so bad, man. Did they take, like, an
Fantastic!
actual picture
The
of it?
adenoids are gone. Now all we have to do is remove all of our equipment and get our patient to recovery. Our patient is in recovery, and he'll be able to go home in a few hours once he can breathe easily, cough,
Oh,
and
that
swallow. We'll
Dude, I thought we
prescribe
had to
some
remove
antibiotics, and once he gets home, he needs
Because
to
they look
drink
pretty
plenty of
fucked
water
up
to
to
keep
me.
hydrated. He'll also need to stay away from solid foods, but he'll get to eat ice cream, sherbet, popsicles, and jello for a couple of days.
Oh,
He might
lucky.
experience a burned taste in his mouth, which will subside after a couple of days. He should brush his teeth often to help alleviate that taste. Scabs might form in the back of his throat from the surgery, and, of course, he should contact his doctor if there's bleeding or excessive pain from where the adenoids were removed. You did a great job today. Try
Alright.
your hand at one of our other surgeries here at surgerysquad.com.
I think I saw Jacksepticeye play the virtual LASIK, but I don't want to do that one because I already saw it, but doing it myself would be good, but I'll do that in another video. I need to recuperate and probably prepare myself for that one. So, oh man, that was red. It wasn't that bad, but I mean, still, those adenoids look pretty fucked up even after getting rid of that thing. So, I guess that's it. See you guys.